I can tell you that when I walk out from an appointment with my Redirect Health, and by the way, every doctor is a Redirect Health doctor because I go in with a Visa card number that they send me just before my appointment, and I walk out and they're now scanning that digital card, so they're paid in cash before I leave, and the doctor loves it. Every time I go see a primary care doctor, and I've seen 2 or 3 different ones because I've lived in 2 or 3 different cities, I tell them I'm your most profitable patient today because the $70 you're getting from me has no billing, no coding, and no pre-auths. And it's just cash. And it's like today, you're getting paid. You don't have to wait 90 days. There's no chargebacks. There's no recoupments. You didn't put the dotted I over Ronnie Barshop correctly. So, without that dotted I, we're going to take our money back, you criminal. They don't nobody likes to get the deal on the phone with these giant middles. And it's not care that's expensive. It's not a bill. It's $1 trillion that, we're talking about here, because the primary care doctors in America are getting about 27 cents on the dollar if they're independent, and they're getting 18 cents on the dollar to as low as 8 cents if they work in a system. Where's the other 70 to 80 cents going? It's going to this administrative class that has risen like, the fungi in the ocean. I mean, it's like the grand, it's like, it's
algae bloom.
It's a bloom. It's an algal bloom, and it's growing. And the problem with that fungal bloom is it's not cheap, and everybody there feels like they have to do a job. Have you ever been on the phone and you got denied something, and you're the doctor and you know the patient and you know the history, and the person on the other end has no medical background?
This is the reason I went into anesthesia. I don't have that problem, but I talked to plenty of my friends who do.
Well, yeah, it's to imagine that you've gone through 20,000 hours of training, a lot of sleepless nights for 3 years, and to have some numbnuts on the other end, some dweeb who is a self-appointed expert who just started yesterday and was trained to give you a denial on a medication that's working beautifully. The anesthesia, you guys, I see why you picked anesthesia. You're a smart man.
I like fixing problems quickly. I don't like having to fix a problem over 6 months, your blood pressure. But I talked to my friend who's a urologist, and he talks about this all the time, where he has a prior authorization issue. He calls the company, and they're like, "Oh, well, sure, you can talk to a doctor, and they'll call you back in a week or something." They call back, and it's a dermatologist who knows nothing about urology. And he's sort of, "Yeah, probably you're right. I guess, yeah, we'll approve this." But it's, now been 3 weeks, and this person had they have prostate cancer. They needed some treatment. And, I mean, there are real issues that these are real people who are having problems getting care. So, I mean, without a doubt, a lot of these things, I think we just accept a lot of these, this sort of learned helplessness within medicine because we are employed or because that's just the way things were. And they obviously have bigger lobbies, and you don't know about these options, right? I think I look at direct primary care in my town, and we've got quite a few. I mean, we've got probably a dozen in a city of about 500,000, a metro area of 500,000, which is quite a few in today's day and age. But I'm certain it would quadruple, quintuple if there was a huge enough market, people looking for it.